Hello, Dr. Berger here at Northeast Medical Practice. There's a lot of controversy both in the medical community as well as debate online these days about what is appropriate protein intake. So I wanted to take a moment to talk about this. So the United States recommended daily allowance, or RDA, for protein is 0.8 grams per kilogram ideal body weight. But in my opinion, this should not be considered the recommended daily amount. This should really be thought about as the minimum to avoid malnutrition. In reality, we should be, for most people under most circumstances, shooting for something higher than that. For example, as we age, we tend to lose about 1% of our lean muscle mass per year. And if we want to avoid that, we need more protein. The reason this happens is something called anabolic resistance, where basically the muscle cells are not able to take up protein as efficiently. So in order to combat that, we really should be thinking more about 1.2 grams per kilogram, and this is ideal body weight, not the weight of somebody who needs to lose weight. So 1.2 at the minimum, really can get up to 1.6 under most circumstances. Now, kidney function, this can be a little bit of a debate, and of course, if you have any renal problems, you should consult with your physician with regard to this issue. But for folks who are aging, and that's all of us, we need to think about at least 1.2 grams per kilogram body weight. For people who are losing weight, and it doesn't matter whether we're talking about doing this through lifestyle or lifestyle plus any medications such as the GLP-1 or GLP-1 GIP medicines that are in common use in the obesity medicine world, in which I also work and operate. You need to also make sure that the weight loss is primarily adipose tissue, fat, and not skeletal muscle, because if we're not getting enough protein, the body is going to look for the amino acids it needs in our muscle and actually catabolize it, start to break it down, and we don't want that to happen. The Obesity Medicine Association recommends 1.2 to 1.5 grams per kilogram for folks who are actively losing weight. I think 1.6 or even a little higher can be fine for a lot of people. Again, if you have particular medical problems like those with the kidney, you should consult your physician, but under most circumstances, this can be a reasonable amount to consider. So, as I've alluded to already, we should be considering protein intake certainly above the 0.8 grams per kilogram, that is the US RDA, probably beginning at 1.2 grams per kilogram for most folks. Higher if we're talking about combating the loss of muscle with age, which can lead to sarcopenia or frailty due to low muscle mass, or if we're actively losing weight. So most folks ought to be considering a little more than 1.2. But again, everything we talk about on these videos is for educational purposes only. It is not a substitute for medical advice. If you have particular questions or concerns about your health, you should seek out your medical professionals, as no doctor-patient relationship has been formed through this video. If you'd like to reach out to our practice and learn how we might be able to help you with your weight and your longevity, we are Northeast Medical Practice, 516-604-3418, online at northeastmedicalpractice.com. Through our social media channels, including our YouTube channel, as well as my LongevityMD podcast on Spotify. But until we see each other again, be in good health.